It's a pleasure to be with you. The title of this talk is Public Health and Community Engagement Introduction. There are no disclosures for this presentation. This slide lists the learning objectives for this lecture. Understand the importance of various kinds of data and analysis in developing strategies to address risky behaviors. Understand the role of public health in changing risky behaviors. And understand the importance of community engagement in changing risky behaviors. As with any science discipline, appropriate data and data analysis and interpretation is essential to develop effective strategies. The first part of this talk will focus on examples of data and how that data informs approaches to improve the wellness and health of populations by dealing with the risk factors associated with disease and death. This is data from the National Vital Statistics System 2012. It gives age-adjusted death rates, the number of deaths per 100,000 total population. The 6 leading causes of death in the United States in 2012 were heart disease, cancer, chronic lower respiratory diseases, accidents, stroke, and Alzheimer's disease. Since 1999, heart disease has declined at a greater rate than cancer. Even though heart disease was still ranked as the #1 cause of death in 2012, cancer was a very close second. By 2009, chronic lower respiratory diseases bypassed stroke to become the 3rd most common cause of death in the United States. In North Dakota, heart disease leads causes of death, followed by cancer, accidents, stroke, Alzheimer's disease, and chronic lower respiratory disease. Notice that Alzheimer's disease is much higher in North Dakota than in the United States in general. North Dakota is generally in the top few states in Alzheimer's disease mortality rates. This slide provides death rates by race and ethnicity from 2009. This data also comes from the National Vital Statistics System and demonstrates the highest mortality rates in non-Hispanic blacks, followed by non-Hispanic whites, American Indians or Alaska Natives, Hispanics, and Asian or Pacific Islanders. The main point is that rates vary by race and ethnicity, indicating the importance of race and ethnic specific data when developing public health strategies for a target population. This slide demonstrates the age-adjusted death rates for the United States and some individual states for comparison. The United States age-adjusted death rate was 170.5 per 100,000 population in 2012. The highest death rates in states were in Mississippi at 231.3 and Alabama at 225.1. The states with the lowest death rates were Minnesota at 119.2 and Colorado at 127.3. North Dakota was the 34th state in rankings with an age-adjusted death rate of 151.6. Another complicating factor in public health is that causes of death are age-specific. The next few slides provide examples of this for 2009 from the National Vital Statistics System, looking at mortality percentages for various age groups. For the 1 to 24-year-old age group, accidents were the most common cause of death, 38%, followed by homicide, 14%, suicide, 12%, cancer, 7%, heart disease, 3%, and all other causes, 26%. For those in the 25 to 44-year-old group, accidents were still most common, 25%, followed by cancer, 14%, heart disease, 12%, suicide, 10%, homicide, 6%, and all other causes, 33%. For those in the 45 to 64-year-old age group, Cancer now moves into first place, 32%, followed by heart disease, 21%, accidents, 7%, chronic lower respiratory disease, 4%, chronic liver disease, 3%, and all other causes, 33%. For those 65 years and older, heart disease was the most common cause of death, 27%, followed by cancer, 22%, chronic lower respiratory disease, 7%, stroke, 6%, Alzheimer's disease, 5%, and all other causes, 33%. Communities are commonly composed of individuals and subcommunities representing the whole age range spectrum. Age-related disease variations and their affiliated risk factors must be considered and inform public health and community engagement processes and strategies. The gathering of national, state, and local health data is critical in the initial stages of community engagement and often establishes the base for program planning. Digging a bit deeper into the underlying factors that cause disease and death is really important. Of factors contributing to premature death, defined as death before 75 years old, 40% of those deaths are related directly to behavior and lifestyle issues or personal choices, 5% to environmental factors, 15% to social circumstances, and 30% to genetic predispositions. 10% of deaths are due to healthcare system deficiencies, which means that if the entire population had timely, error-free treatment, the number of early deaths would be reduced by only 10%. A major point is that poor behavior and lifestyle, personal choices that people make, are a major determinant of health, disease, and premature death, and influences the development of risky behaviors and even the self-management of chronic diseases. Healthcare in the United States is expensive compared with the rest of the world. In 2006, 16% of GDP, or gross domestic product, in the United States was spent on healthcare. We're leading the world in this statistic, and that's not a good place to be in. In comparison, Switzerland, France, and Germany spend 10 to 11% of GDP on healthcare. This graph shows the trend of GDP spending on healthcare since 1970. The United States is pulling away from the pack. In 2007, in the United States, every person on average spent $7,146 on healthcare. So we spend more, and the assumption is that we therefore have the best health status in the world. Unfortunately, that isn't true. Despite all that spending, the United States ranks 37th in the world based on a number of components of the Health Performance Index, including responsiveness, the respect for persons and client orientation, fairness of financial contribution, the fraction of what households spend on healthcare, overall level of health, the measure of disability-adjusted life expectancy, or DAIL, distribution of health in the population, the measure of inequality, and distribution of financing, how fairly the financial burden is shared. The healthcare and wellness system in the United States needs a major overhaul to meet the needs of citizens in the future. Some major issues to address include the transition from disease to a wellness orientation, the transition from fee-for-service to outcome-based reimbursement, increasing the number of and distribution of primary care clinicians, establish effective medical homes, enhance the integration of public health and primary care, as recommended by the Institute of Medicine report in 2012. Improve access of the total population to healthcare and wellness services, an equity issue, and truly engage communities to own their problems and solutions. There are three major sets of tools to change risky behaviors: policy, influencing an individual one-on-one, the clinical, and population-based interventions. Policy is developed by local, state, and federal governments, businesses, and organizations. It's an effective tool to encourage healthy behaviors, but must be implemented and enforced to be effective. Clinicians are trained in one-on-one counseling, another powerful strategy to change risky behaviors. Population-based interventions provide another potent behavioral impact and can be divided into two tool subsets: social marketing and community engagement. Population-based expertise lies in the discipline of public health. We need to use all these tools in a coordinated way to change risky behaviors in our population. Increased public health investments, especially in low-resource communities, has been associated with decreased mortality from preventable causes of death, including those associated with infant mortality rates and death due to cardiovascular disease, diabetes, and cancer. For each 10% increase in local public health spending, mortality rates fell between 1.1 and 6.9%. The lifespan of Americans increased by approximately 30 years from 1900 to 1999. 25 of those years were due to public health interventions, where only 5 years could be attributed to healthcare advances, including medications like antibiotics, surgical technology, or life support. Even of those 5 years due to healthcare advances, 1.5 years were due to clinical prevention practices, including vaccinations and health screenings. The 10 health achievements that significantly impacted lifespan in the 20th century included vaccinations, motor vehicle safety, safer workplaces, control of infectious diseases, including things like sanitation, clean water, and sewage handling, declines in cardiovascular heart disease and stroke deaths, safer and healthier foods, healthier mothers and babies, family planning, fluoridation of water, and recognizing tobacco as a health hazard. There are 4 basic attributes of successful programs for changing risky behaviors, including high-level leadership support, use of best and promising practices, adequate resources, and community engagement. Leadership support is essential for effective programs in changing risky behaviors. A national program requires support from the president or the president's wife, a state program the governor, a city program the mayor, and a business the chief executive officer. The use of best or at least promising practices is extremely important. Implementing poor ideas results in poor outcomes. Promising practices are often needed in special circumstances to help define best practices. Adequate resources include people, time, and funding. Community engagement brings an additional set of tools to the health messaging toolkit to change risky behaviors that ultimately will improve quality of life and decrease healthcare costs. Communities provide powerful venues to improve the health and well-being of the group in primary, secondary, and tertiary prevention. Basic community engagement concepts must be understood and applied to effectively facilitate communities to own their problems and solutions. This slide lists 24 topics used to train public health practitioners in community engagement. Poor lifestyle choices occur in all age groups within our society. We need better interventions and programs to change risky behaviors. Current healthcare messaging has not been as effective as desired. Enhanced integration and coordination of policy, clinical, and public health interventions is essential to adequately change the risky behaviors that are literally killing us. Community engagement is a new set of public health tools that facilitates communities to own their problems and solutions.
Take your public health practice skills to the next level. Our specialized certificate courses give you an opportunity to work systematically through a public health topic and demonstrate your understanding of that material in a capstone project. Learn more and sign up at ndphtn.com/certificates.